Hello, everyone. Thank you for joining the call today. I'm Alana Jarman. I'll be going through the series today. It's Leadership for the Coalition. It is a series. This is session 2 of 4, and it is a 4-part series. The next one will be on July 2nd at 3 p.m. Mountain Standard Time. They are 30 minutes long. We are leaving 30 minutes during the last hour for open discussion and some resource sharing. Just some housekeeping items. If you're not talking, just please keep yourself on mute. And if you do want to put yourself on camera, which is completely fine, just be mindful of what we might see in the background. A little bit about Mountain Pacific. We are a nonprofit company, but we have federal contracts with Centers for Medicaid, Medicare, which makes us a quality improvement organization. And we have a contract with Centers for Medicaid, Medicare, CMS, that we call our task order. So you may hear me refer to task order 1 a bit, and that's what I'm referring to. So I can say that I'm honored to be a part of the Mountain Pacific team. And we do serve the states of Montana, Wyoming, Alaska, Hawaii, and the U.S. Pacific Territories. So thank you for taking time out of your day to join this call today. Let's get started here. So some of the things that we're going to go through today, we're going to talk about who facilitates the coalition. We're going to talk about some roles, responsibilities, members, assets, and power. We're also going to go through what are examples of coalition goals, some practical goals, some tools for the coalition, building the coalition up and how aligning goals works. And we're also going to talk about where does the data come from and designing SMART goals early on and helping improve outcomes and alignment of other goals. And then also to talk about when to assess and reassess your goals so that your coalition work is sustained so you keep on track and track your success. So if you do have any questions, comments, or anything in the meantime, you can go ahead and put it in the chat or just interrupt me and we'll keep this pretty informal. So, all right, let's just do a little recap of what we talked about last week. The last session was on June 4th, which is recorded and it is on our Mountain Pacific website. So if you didn't get a chance to hear that session, it is recorded and you can listen at your own convenience. We talked about what the purpose of a coalition is. We discussed why they exist, is to create and or support efforts to reach a particular set of goals. We also talked about using SMART goals to help identify the opportunities to improve outcomes within your community and help focus and clarify how you need to focus your resources. We also reviewed the mission statement, mission, vision, and purpose, which the mission, this statement should describe the purpose of the coalition existence. It's a succinct statement that's unique, realistic, and it uses keywords to make it memorable. This is essentially the why you are meeting. A vision, this is a statement where you want your efforts to lead to. You want it to be realistic, clear, descriptive, and above all, consistent. This is a statement of where you want your efforts to lead to. And then the purpose, essentially the how in your coalition work. And some key words we often hear in a purpose statement is build, sustain, improve, educate, engage, and so on. So doing an inventory of other coalitions, groups, organizations, and so on, working on similar goals is not only important, but it helps to reduce duplication of effort and also inclusion of the right people at the right time to influence change that the problem or issues affect. Researchers have also identified the importance of coalition structures in predicting coalition progress, excuse me, and the traits for success. And those key factors that affect coalition function and sustainability are leadership, membership, structure, vision guiding action, funding diversity, sustainability planning, and contextual factors. So for this session, let's talk about roles within the coalition. To be a part of a coalition is important work. And to lead a coalition takes a couple extra skill sets that takes practice to develop. Some of these roles may not be existing within your coalition, which is fine. Coalitions do have dynamic and meaningful relationships with the organizations to which the members are representing. And some members may be volunteers or patient family advisors. So the capacity of your coalitions to continue to build up and form that commitment to action is really reliant on your individual members and your strategic planning and decisions as a whole. The amount of time that each role should dedicate to their tasks is also important to discuss early on. So the coalition lead or coordinator's role or roles, sometimes there is more than one person leading, is to communicate and mobilize others around your mission, vision, and purpose while using good interpersonal skills. Other skills that this role should entail is being able to prioritize effectively based on what resources are available to the coalition. It would be a mistake to assume that everyone that sits on the coalition wants the same thing. This is where determining the foundational elements early in your coalition work, like your mission, vision, and purpose, conducting an inventory of your resources, which includes your members and their time to dedicate to the work of the coalition, as well as monetary resources. So when it's time to help focus your resources on the tasks, prioritizing them will be easier for your members to understand the rationale why certain tasks are prioritized before others. A few other things: trust, transparency, and understanding the satisfaction with participating in the coalition helps to build that rapport with your members. Building rapport is part of the process to inspire, build constructive direction, and be the role model for coalition members. Another role, a coalition administrative assistant. This role is dedicated coalition leads to take care of these important functions. It's important to have consistent communication to coalition members to relay updates, provide meeting information, and then have someone that can dedicate time to respond to questions or at least forward questions or concerns from coalition members or outside organizations or groups to the coalition lead or leads. Also, as we are allowed to start holding events in person, having the time and skills to help with this event planning. Skill sets for this role involve good communication skills, having good experience with technology platforms, and then help with facilitation during the meetings. Coalition members, last but not least, are also dynamic roles that involve the individual members, organizations, and possibly patient or family advisors. Capacities of the coalition members include the ability to work collaboratively, resources you can contribute to the coalition, as well as sharing ideas and experience in relation to the tasks at hand. So when we think of a coalition member, we think of the individual member, but we also have to consider the organization they may represent. It's important that their employer supports their role within the coalition and may be able to contribute more than just an individual to attend the coalition meetings. Also, having a charter to explain the mission, vision, purpose, and identify goals or tasks that can help facilitate that conversation for the employer to understand what contributions are available or needed to the coalition. With volunteers, there is much to be said about those who serve on a coalition as a volunteer and to respect their time as well. Work groups may also form under your coalition to work a more focused objective or task. Having work group chairs will help provide that communication to and from the coalition leads and members. The work group chair or chairs will provide agendas, coordinate with the work group to provide focus, record minutes, and so on. It's important the work group chair is fair, consistent, and promotes collaboration. So a researcher by the name of Robert Gass had commented in an article that he'd done some research, and what he found was meetings, work that had been done in meetings, and on average it was noted that 37% of time at work is spent in meetings, but up to 50% of that time is wasted. Hence why facilitation skills are imperative to the coalition leaders. Being a facilitator is a very important role, and the success of the work is very dependent on the group or coalition. Relationship building is a cornerstone of being a good facilitator, for willingness to follow suggestions and/or directions, listening to the comments, concerns, and being fair with responses is part of the relationship building within the coalition. Being neutral and open-minded also allows coalition members see the commitment that the coalition lead or facilitator has to ensure that everyone has equal say. There will be conflict with members, there's no doubt on that, but being able to respectfully allow the discussions to occur, but know when to intervene and put the conversation on pause or up on the parking lot, so the meeting does not end up being unproductive in order for action steps to be developed. Setting clear and high expectations by encouraging and supporting your coalition will stir up emotions and passion within your coalition members. So just because there's conflict does not mean that there isn't good that's coming out of the meetings. Another researcher, Bernard Bass, had discussed concepts for transformational leaders in his book, Leadership and Performance Beyond Expectations, and it's still held in high regard for business leaders today. When you focus your efforts toward investing in a project or goal, it takes a lot of perspective in order to be certain of the outcomes you feel are realistic to achieve. When your coalition members see and feel the strong leadership, buy-in and motivation occurs. And I would argue to say that this not only occurs in coalitions, but within organizations as well. As far as the size of the coalition to a point really does not matter, but rather the quality of engagement from your coalition members. Of course, the more people there are, the more discussion and insights, but also more of an opportunity for networking, information sharing, skill sets, and so on. So shown in this slide, some of the actions of a facilitator takes on are listed. Being positive during times of conflict and uncertainty helps to maintain the focus, reminding the members that Rome wasn't built in a day. We'll keep the focus on the task at hand, which should be outlined in your agenda prior to the coalition meetings. Also, knowing when to hold them and knowing when to fold them are also part of a process to create change. But this isn't decided with just the leadership, but as a whole coalition. And hearing feedback and concerns are part of that process. So be patient and be kind. When you begin your work on your recruitment efforts for your coalition, think of what the purpose and scope is for your coalition. The more diverse and non-traditional your membership is, the more of a realistic strategy can be developed to achieve your goals. So, for example, if you're working on, let's say, improving self-blood pressure monitoring in the patient population you serve, look at strategies from a holistic view. You want to include the workforce, your other constituents that may also be working on similar goals, and of course, community members to allow for a patient and family perspective. Montana's 1815 team is partnering with our work for our CMS task order, Goal 3, for chronic disease management, as well as other state and local chronic disease organizations, such as Million Hearts, to work together to achieve similar goals. This allows pooling of resources, which remember are people, time, money, space, and other logistics, but also data. This gives that work smarter, not harder saying a real meaning. Other types of members that could be a potential are including business owners, grocery stores, restaurants, manufacturing stores, and so on. Also, university systems, other nonprofit groups like American Cancer Society, Agency on Aging, AARP, elected officials, cultural groups, educators, religious organizations. The list really does go on and on. But the point being, don't limit who you think would be appropriate. All these other potential member types could bring in a whole new perspective and help with the sustainment of your outcomes. For meetings, even if your coalition has been in existence for years, sometimes it's good to revive the group with a kickoff type meeting to reintroduce who is on the coalition, the purpose, mission, and vision, and goals or tasks your coalition has chosen to focus on. For members, having an orientation guide to help them understand what their role is, structure of meetings, how to contact other members, and so on. It's very helpful. Not many coalitions do this, but it is a great thing to have. Also, having a charter and bylaws for your coalition helps everyone understand their role and responsibility in the coalition. Also, and only if there is a continued conflict with a member and causes discourse or impedes the coalition's purpose, having language on how the coalition leaders will handle that situation is vital. Purposeful meetings results with action, creating timelines, responsibility, a process for evaluating and how often to evaluate, and a pulse check or Gemba, which is a lean terminology of the action of the leaders being involved with the monitoring of the results of the actions. I recently attended a telesite call the other day, and Dr. Eric Arzubi was our guest speaker. And a question that I had asked about staff turnover, which I also feel applies to coalition membership, and his response was monitoring your results, and if you can show that your results are effective and making a difference, then the morale of the group will improve because all your hard work is paying off and you are seeing success through whichever evaluation methods you choose to use. Efficient and effective are different terms. A quote from Born on Lean is, quote, "Efficiency is doing things right, while effectiveness is doing the right things. Strategic goals need to be effective, doing the right things to take it to the next level. If a goal doesn't have that kind of broad impact, it's probably not strategic," end quote. For management, garnering the buy-in and respect from your members takes the coalition from efficient to effective. Hearing the voices and listening to the experience from your members ensures confirmation they agree and support the coalition goals. Meetings must be organized, follow the agenda, and be respectful of the members' time for attending the meetings. Having your agenda prepared and sent out ahead of time, following up on action items per the timeline set by the coalition, and review any data or feedback to evaluate the effectiveness produces a meeting that when members walk away, that sense of accomplishment and satisfaction occurs, which results in retention and improved shared responsibility. Also, being transparent about setbacks, needed changes to the goals, or any structural logistical issues puts the coalition lead in line with being who their members want them to be, trustworthy and acting for the greater good of the community they serve. There will be setbacks and things that derail the work of the coalition, such as a pandemic, but it's how you handle it is what keeps your coalition successful. So when we talk about goals for the coalitions, using tools such as crosswalks, consulting with subject matter experts in the focused area you're trying to improve, gives you a well-vetted plan to strategize how to get the outcomes you're trying to achieve. It does take a team to determine the goals, and it takes an even bigger team to get to the peak. So go ahead in the chat box, type what kind of tools your coalitions have used to understand the focus for your work. What kind of work have you done and what tools have you used? So next up, we're going to hear from another Mountain Pacific team member on how aligning goals with other organizations work on achieving similar goals. Caitlin, the floor is yours.
Thank you, Alana. Here at Mountain Pacific, we are currently working on a pilot project to establish a statewide learning and action, or LAN, around diabetes management and cardiovascular disease. Eventually, we would like to expand topics as we refine the process. The driving force between the approach is to focus on value-added content, meet the needs of the healthcare organizations, reduce burden, and increase health outcomes. We all work together. Everyone teaches, everyone learns. The LAN will provide the structure for a statewide focus on improvement. It is important for our team, along with the various stakeholders throughout the state, to align our goals utilizing data and technology, clinical best practices, education, and peer-to-peer sharing. Moving together will help us achieve these goals at a much faster rate and experience greater success. Next slide, please. Great. As we work toward goal alignment, we have defined key activities to aid in implementing the approach. This includes group education, including the use of subject matter experts from the field. We will also be conducting lots of peer-to-peer sharing. This tactic has proven very successful, allowing for learning and growing from each other's successes and failures. Data collection and analytics are always the foundation of the work we do. Additionally, bringing together all the key stakeholders working on similar projects will help us fill the needs and gaps identified in both care and resources. Because the statewide group will be relatively large in size, our intent is to utilize working groups and affinity groups to drill down specific metrics and goals, allowing for faster movement and response. Working groups are established to focus on a specific short-term assignment or project identified by the larger group. Our affinity groups are groups of interested participants focusing on implementing QI projects targeting a specific topic or a goal. Next slide, please. So the statewide coalition is a vehicle to organize and distribute the education, tools and resources, guidance, and support that the community and facilities may need to achieve their larger goals. Our hope with large-scale goal attainment is to provide benefit to the multitude of stakeholders. First, we know that clinics and frontline workers are extremely busy, so fewer meetings with efficient and structured approaches can continue to reduce the burden. In addition, it's a great opportunity to enhance community linkages while working on innovative approaches to care delivery with access to subject matter experts and best practices from their peers. The participants in the work group will experience similar benefits as the others, including the community, the SMEs, and peer connections. And most importantly, a unified approach to that goal attainment. Lastly, the patients will see a huge benefit from the aligned group efforts. I know as patients, we are constantly interacting with different healthcare systems and stakeholders. By standardizing communication, tools, resources, and marketing, we will really have a significant impact on the health literacy and the patient engagement and activation we're seeing. As we work to align our goals, whether internally or externally at a state or even a regional basis, it's important to set SMART goals. I'm now going to pass it on to Alana to discuss this in more detail.
Might help if I unmute myself, huh? Thank you. Thank you very much, Caitlin. So as you guys heard, some of the examples of how Mountain Pacific has taken the approach to collaborate with other groups, such as the 1815 work. And for those of you who are unfamiliar with 1815, it is a CDC funded project that we partner with our Department of Health on chronic disease management. So, and I am definitely opening it up to other Mountain Pacific staff on there that have any other input or words of wisdom for anybody else regarding the alignment of that project. So during the last session on June 4th, we reviewed what SMART goals are. And today we went through alignment and goals. When you set your goals and when you discuss the strategies to meet them, use the SMART methodology. so you can put a time frame and specifics to the goal. So a goal is broad, whereas objectives narrow the focus. Then a strategy is a specific action on how to carry out that objective. And during the last 30 minutes, I'll bring this tool up that you see here. It says click to download a free SMART goal. This is something that is on smartsheets.com, but also through ihi.org. There's many other types of templates out there, but we'll bring this one up and we'll go through creating a SMART goal. So now we have a polling question if you want to pull that up. And the question is, would a training on data collection be useful for you? Do we have a polling question to pull up here? Maybe not. So maybe if you want to just type in the chat box, if yes or no, whether a training on data collection would be useful for you. And the reason why we're asking internally at Mount Pacific, this is something too that we'd be happy to provide and put together for coalitions. And Sandra, I see you raised your hand. You can go ahead and unmute yourself if you do have a question. Let's see if I need to, do you need help unmuting yourself? Or maybe you accidentally pressed something.
Also, Alana, Veronica Cruz asked if you could put the SMART goals worksheet link in the chat.
Sure can. I think I would have to minimize my screen here, but I'll do that after we're done when we get to the end. So I am not sure. Are we able to unmute everybody? There we go. So you're all unmuted. So if you do have a question, now's the time.
I was making some courthouse dolls for everyone, but they turned out wrong, so they look like monsters.
Is someone talking?
In the fire. Well, Anne's keeping us warm, and that's important.
I think we'll go ahead and mute everybody again.
Something on it's a time year ago.
All right. So I see we do have some of the responses. Yes, a data collection would be helpful. So we'll go ahead and we'll talk with our internal team and we'll figure out how to get that going for you and more to come on that. So just as we wrap up here for the presentation portion, and like I said, the last 30 minutes, we'll go through a couple tools and tips and tricks that anybody wants to share. So Mary Argonis, are we able to allow people to unmute themselves if they have any questions?
Yes, they should be able to.
Okay. Perfect. So if you do have any questions or comments at this time, you can go ahead and unmute yourself. None so far. So we'll just move right into some open discussion. So how has your coalition planned for sustainment in your work? If you've identified a focus goal or task that your coalition wants to work on, have you thought about how to sustain that outcome after you achieve it?
For the coalition, I'm sorry. Was someone else speaking?
Nope, nope, go
Oh,
ahead.
okay. So this is Dree. I apologize. I was on another call. One of the things that we're doing here in Wyoming for our Million Hearts Collaborative is that the Coalition for Sustainment, they have, number one, thought about evaluation during the planning process. And another thing that they're looking to do is maybe have like groups set up where we have a group that focuses on like long-term outcomes, like what's the big picture item that we want to reach. And then they're looking to maybe have that group like conduct a survey so that we will always have like maybe some priorities that we can always keep in the forefront of our work. And then what tools do you have and use to evaluate your work? Oh, I'm not the evaluator, so I don't have a comment for that one.
Well, thank you for your input. That was very, very helpful. Anybody else? How about some evaluation methods? What kind of evaluation methods has anybody used? Pretty quiet bunch today. So when we talk about specific metrics for your coalition work, how do you know how to focus your resources that you have within your coalition or group? How do you prioritize? RCA, PDSA. Thank you, Maggie. Maybe you want to speak up and talk about how that process went.
Well, at the very beginning of the coalition work, the folks gathered together their teams and discussed reasons for, the challenges, the barriers to 30-day readmissions, or in the community, what were the biggest areas that they could work on. And through their activities, and of course the data that we shared or that we had in previous activities that we had, we looked at some of the biggest factors of what was going on, and part of it was people just didn't know what was available as far as community resources. And so several of the teams decided they wanted to do what they called a minimum requirement checklist to help with the communication of what was required on a post-acute transfer to that facility setting, and also becoming more aware and knowing the people on the other end of the phone. And that's why the coalition with their face-to-face meetings was found very beneficial, because now they could put a face to the voice on the phone, because they were now meeting with each other and they developed trust, and it was found helpful to improve the care transition and the communication of information to the other settings. So if anyone else has any input you'd like to chime in, please do.
Yeah. I'm trying to remember my password for IHI. So again, like I said, in IHI, they do have a lot of different tool templates to help guide your process. If you wanted to do a root cause analysis or a PDSA, Debbie Butt says initial data would be beneficial. We identified goals, projects through discussion. Was post-acute transfer developed on paper or in the EMR? I think that was maybe a question for you, Maggie.
We had mostly paper, but PDF, electronic. They also then developed what they called a community partners capabilities list, which was a huge poster, color coded by all the members by their settings. So, and it was a big list. It was taken, the information was from the Interact toolkit on the capabilities, and it became modified for the community partners. And so there was contact information. So that was a big poster, and it's out on our website under, I believe, West Oahu and Windward Community Partners. And also they did minimum requirement hard copy of the requirement list, which folks used. And then we developed the ring card binders by setting, and those were laminated. But each setting had their requirements, and that's what they used, and they found helpful because they had all the information in one spot and they could stick them in their pocket.
Great. Does that answer? Okay. Maggie, could you share the website in chat?
Let me try. Hang on. Keep talking. I'll get back to you.
And then for those of you who do need to jump off, we do have an evaluation. Mary, if you were able to put that evaluation in the chat box again for me, I would appreciate that. And as promised, I do have the tool pulled up here. If I can get, there we go. Can everybody see that? The SMART worksheet?
Yep.
Okay. So another tool that just explanation, this is something too that Mountain Pacific helped to develop. So setting SMART goals. So the first step in achieving your goal is articulate what your goal is. And it goes through what a weak goal statement is. Creating a strong goal helps you achieve your goal. And a goal statement must be SMART. So that's specific, measurable, attainable, relevant, and time-bound. So again, to go through each of the areas, specific, make sure it's specific, and it should answer the 3 questions according to the model for improvement. What are you trying to improve? How can you do it? And how will you know the change is an improvement? So again, when you set up your SMART goals and your objectives, that's why it's really good to determine what the scope and what resources are available within your coalition. So again, it's realistic. Measurable. To reach your goal, you need to measure any outcomes. And recently, Mountain Pacific sent out a data wish list to the coalitions, and that's to help us understand what are the priorities right now for each coalition in terms of metrics. And then attainable, define the rationale for setting the goal measure. Is it realistically reaching given your resources and time? And relevant, how will that goal address the actual problem or need? And as Maggie talked about doing a root cause analysis, understanding what the actual problem is. And some of the ways, if anybody of you are familiar with asking the 5 whys, asking why 5 times until you get to the real cause, the problem. And then time bound, what's the target date? And being realistic with setting enough time for your goal so you don't lose that momentum or lose track of your goal, which negatively will impact your performance and the engagement of your coalition. And I see Maggie just put a tool in the chat box. Let's see if I'm pulling it up here. So if we go back to the SMART goal. So someone shout out, what's a goal that we can start practicing with? What's a goal that you have in mind? Don't be shy. Let's see.
Reduce the number. For Wyoming, I would say our overarching goal is to reduce the number of Wyoming residents with uncontrolled hypertension by 10%.
All right. And so going back to our tool here, specific. So to make sure your goal, it should answer the 3 questions. So what do you want to accomplish? Who needs to be included? When do you want to do this? Why is this a goal? So what do you want to accomplish? Based on the resources that you know that you have. So we have the initial goal, we have reducing the number of Wyoming residents with
Right.
uncontrolled hypertension by 10%.
Well, I want residents to check their blood pressure 3 times a day after each meal.
Okay. Who needs to be included?
The provider, the pharmacist, the patient, the parent if it's if a child.
Anybody else have any suggestions? When do you want to do this by?
The grant year would end June 29th of 2021.
All right. And then why is this a goal?
Because 1 out of 4 people in the state are at risk for a heart attack or stroke.
Okay. How's this looking to everybody? Any input? How can you measure progress and know if you've successfully met your goal? And going back to how will you know you reached your goal?
The provider could be having some monthly meetings or weekly meetings with the patient and document in the EHR.
What are some other measurements? If we're thinking about measuring or
You can do weight for the patient. You can get their BMI, because most patients with high blood pressure, they're more likely overweight. So if you can control their weight and their eating behavior, then more likely their blood glucose will also go down. Their high blood pressure will go down.
Okay. So one of the things that I'm asking myself right now is, we talked about reduce the number of Wyoming residents.
Mhm.
Do we have a specific age range or geographic area? Or are we just doing the whole state?
For us, we're focused on like our high prevalence areas,
Okay.
based off of some like mapping that's been done by our epidemiologists. So it is like a targeted population.
Okay. So thinking of what kind of data that you would be able to get from those high prevalence areas and from those providers in that area. How can you measure progress and know if you've successfully met your goal?
We can look at births data.
Okay. Anybody else have any input on this? How about Brandy and Caitlin, Mary, Crystal? Debbie says, could it just be a blood pressure range? What is BRFIS data? Who can answer what is BRFIS data?
BRFIS is the Behavior Risk Factor Surveillance System. It's an annual questionnaire that people in your state would do via house telephone, because they don't call cell phones yet. But it's like an annual call where someone from the state will call a household and they will ask them some health-related questions about tobacco usage, healthy behaviors, their awareness and attitudes on different things. I don't know all of the questions, but I know the CDC collects that data and they put out information, but every state has the opportunity to ask like some standard questions. And then there are additional modules that you can ask, of like a list of additional like 7 questions to the person, where you can, oh, there we go.
So as she was saying, yep, it is collected in all 50 states, as well as the District of Columbia and 3 US territories. So it should be available pretty much everybody on this call. I would say the only drawback with BRFIS data, I think it has a bit of a lag time. So if our goal is by, would we say, June 29th, 2021, so that essentially is 1 year from now. If you're using that to see the interventions that you're putting in place now for next year, you may not see that through BRFIS. If correct me if I'm wrong, anybody.
No, that's right, because data usually isn't released until fall.
Yep.
Of that following year.
Yep. So when we consider where we want to get data from and what might be helpful, that's another consideration when we look at our metrics.
Could you use the NQF, the national qualifier, the NQF 59? That's what, no, that's not the right one. That's not the right one. There's a NQF number that providers could put in. Oh, there we go.
Yep.
NQF 18. Thank you, Brandy. Could we use that to like track progress?
Let's see. I'm trying to pull it up here. See if I get the right. So NQF 0018, controlling high blood pressure, and it's a national quality strategy domain, effective clinical care. So Brandy, do you want to speak to this at all?
I can speak a little bit to it. This is something that the providers would track in their clinics with their patients only. So we would have to get, I don't know where we could get state level data using NQF information. But it would certainly help if any of our clinics had done specific interventions to track their progress with their patient population. But on a state level, I don't know that NQF measures would be useful.
Yep. So now when we think about this process and just coming up with a SMART goal, do you see we've had a lot of collaboration among each other. We're brainstorming different types of way we can pull data, what to look at. So as you can see that when you work together with your coalition, how it's nice to have that diverse membership among your coalition to be able to come with realistic goals. This is another tool that Maggie had put in the chat. And let's see, I don't know if you guys can see it very well. I have this on my giant monitor, so I can't really tell how well you can see it or not. But this is the tool that Maggie was talking about, the capabilities list. Maggie, do you want to expand on it at all?
Sure, you can see that all the partners identified what their capacity and what they could do. And they put a checkbox. Of course, this is old, so it hasn't been updated with, it was updated a while back ago. But you can see we had our acute rehab, we had our skilled nursing facility, home health, hospice, and we also had pharmacy in there. We had adult daycare and urgent care. I guess on one of the later ones, maybe that was Windward, where we had pharmacy capability and capacity. So they went down and checked the boxes. A lot of learning on this, where in some instances it becomes outdated when we have a organization who goes out of business or name changes. So in the past, we always thought we'd have a contact name, but then we learned from that for future development, where we put a generic phone number as a contact and email. So it was just found helpful to the partners when they were discharging folks from the hospital to home health or skilled facility, if they had bariatric services and what the weight requirement was for their scales, how heavy they, or the weight of the person, how big they were, if they could manage them in their facility. So
how about the burden of time? How many people did it take, Maggie, to put something like this together?
Oh my goodness. Edits and re-edits and back and forth. It took a while, but it is very important to have timelines. And then everyone wanted to put their logo in the bottom of the page, so on the tool, which was nice because they all knew that they had worked hard on this together, and logos were added. And again, the lessons with the logos, they had to be high resolution, and but it did take quite a while. It was a very lengthy process.
Yeah. Well, I appreciate for showing that. Another tool that I wanted to speak to, I guess. I'm on the Montana Cancer Coalition, and this is a tool that we had worked on and put together for cancer screening and just putting some different resources on. So for instance, I live in Gallatin County in Montana. And if you click on the county, it just talks about, you know, this is under diabetes prevention. So I would know if I'm looking for an SME or a subject matter expert in my state or in my community zip code area for my coalition, I would know, okay, I can maybe reach out to them. And for diabetes education, you just click on whichever county. So again, something like this, and you know, just to kind of get an idea of who else may be working on something, who else might know something about your focus area or goal. All right, so getting back to our SMART goal, and we have just a few minutes left here. So let's move on to our A, achievable. Do you have the skills required to achieve the goal? If not, how can you obtain them? What is the motivation of this goal? Is the amount of effort required on par with what the goal will achieve? I'm gonna put you on the spot again, Adriana.
Do the collaborative, not me, do the collaborative have the skills to achieve this goal? Absolutely. Just to, I must say, I really like that capacity poster that was just shared with everyone, like put the check mark about their skills. I thought that was like really, really nice. So,
and you know, really, oh, go ahead.
I was just about to say, if not, can they obtain them? I feel like if we had, I was going to say we had like that capacity poster where all of the partners like noted their skills. If we had a gap, then we could use that poster where we can contact that partner and be like, hey, I know you're not a part of this, but do you think that you would be interested in at least, you know, helping with this part?
Yep. And that's why, again, like important, you know, whether your coalition has been in existence for years, like I said, or if you're just starting up, understanding who's on your coalition and what essentially can they bring to the table, what skill sets do they have, and what their organization may be able to fill in as well. That's good to know that way. So you have like a tool belt.
Right. Yeah, I like that.
Yeah.
What am I setting this goal? Why am I setting this goal now? Is aligned with the overall objectives. We setting a goal now so that we have something to work towards. We are no I don't know about you, but sometimes you can be in partnerships and collaborations, and along the way you'll forget why you all were working together. So if you have an actual goal, then at least everyone knows what you're working towards. And is it aligned with the overall objectives? In my opinion, I think it does align with a lot of the objectives.
And how do you know that it aligns with your overall objectives?
Because you will have some objectives at some point that the group will have established, and we would just make sure that they align.
Okay. Yeah. And you know, if you have your goals and objectives and you're setting a specific goal using a SMART goal, understanding what maybe numerator and denominator you're looking at, so you have some sort of way to pulse check.
Okay.
Yeah. What's the deadline and is it realistic?
The deadlines are never realistic because life happens. But tentatively, it would be to 2023.
Okay. Just the year 2023?
That's when the actual grant ends, correct, 2023. Okay. So December 2023.
Okay. So based on going through this, how do you guys feel? Would this be helpful for your coalition to go through?
Yeah.
Yeah, okay. And this could be part of, when we talked about asking about the data training, if this would be helpful to kind of essentially guide your training through understanding how to set a goal and then using the data to understand whether or not you've met that goal. Seeing a lot of yeses in there. Perfect. Well, I hope this was beneficial for everybody and a value added to your time. I do appreciate you joining, and I very much appreciate, thank you, Adriana and Maggie, for typing in and helping us go through these. So any last questions, comments, concerns before we conclude? Thank you. Yep, it is being recorded and will be available on our website again. All right, well, with that, thank you everybody for joining, and I hope you have a fantastic